All right, what a delightful piece. We're moving on, and so the next presentation is by Dr. Yin Aung. She's also from UNICEF, and her presentation relates to the Sustainable Development Goals and really looking at the implications for them for South Africa. She also emanates from UNICEF. She's been a doctor and a public health practitioner for 20 years, has a particular interest in immunization, but also other issues like HIV and reproductive health. So thank you very much and welcome, Dr. Young.
Thank you very much and good morning. I'm privileged to be here to talk about what is the implication of this big strategy in this country. When I tasked to talk about this topic, I feel like which direction should I go? I'm someone coming from outside, knowing very little about the country and give it some suggestion. So please bear with me. I have few slides just to talk a little bit about what could be something that from someone coming from the outside to have the regional perspective, that what I see is something that could improve. Sanjana talked about this SDGs, Sustainable Development Plan. This is very much equity approach, talking about no child left behind. And in this strategy, when you talk about the health strategy, good health and well-being, it's talk about maternal health, child health, reproductive health, to talk about the environmental health, a big spectrum of universal health coverage, to research and development, talking about health financing. So talk a big, much broader than MDG, talk about the big spectrum of health. And when you look at the global strategy, this is a global strategy for women, children, and adolescents from 2016 to 2030. This is based on, led by WHO, which is inspired by the success in the 2010 strategy for the women and the children, and also to accomplish the MDG goal, which is not accomplished, to continue the not achieved by the MDG, and putting the women, children, adolescents at the center stage of the SDG. And when you look at this, this global health strategy, it's more comprehensive and taking the indicators of 34 indicators, which is overlap with the SDGs, but also look into more in-depth, so adding 6 more indicators to accomplish by the countries. So what is the implication for South Africa in the countries? The global strategy, like I said, that which is closely linked to SDGs, and this calls for investment in civil registration, vital registration, which encourage to have the quality information about the death, what is the causes of death, and also to have the household surveys. In South Africa, there is a lot of plethora of information, management, health management information system routinely reported, but what I feel from outside perspective is that community-based, population-based survey is done only every 20 years, or sometimes we don't see as often as that we want to see from perspective of WHO, UNICEF, from the global organization. Another is from, we need the data from aggregated data for equity analysis, equity not only for the boys, girls, geographic region. So this is the important piece, looking at from the data, from disaggregated data, to not only for analysis, but for how to communicate and how to use the data for action. And also encourage for web-based technology, which is nowadays web-based technology is using in every country. I think South Africa is ahead of the curve. And also some data is missing for the adolescent. In this new strategy, talk a lot about the indicators, talk about the adolescent. So adolescent from the data from antenatal care, family planning, to HIV-related data, prematurity, from all sorts of data for the adolescent, which I think is something that sometimes not information is not available in South Africa. And guiding talk, and what is South Africa doing? I think that you all from this room know about the what is South Africa, what is the documents which is available here, integrated strategy, and which have the midterm review looking at what are the gaps and what are the area to improve. Also the ministerial reports, which when I come to this country, you have the data from every source and the reliable data. So these are the documents that guiding for South Africa to go way forward. And there are also the investment case. If you invest in, this is with the Wood University, looking at what are the intervention which give you the most benefit from using the resources. Also, newborn area is given much attention. There is a happiness framework looking at the health system, looking at the human resources, to looking at what is the prematurity, infection. So these are the strategies that in place. And also currently new MNCH adolescent and nutrition strategy is being developed, and I think that it will be going to be ready by end of the year. And also, what I see is that the quality improvement is also being done in this country, looking at with the recommendation from the strategy midterm review, and given the recommendation implementation is this having the dashboards, looking at the red robots having red, green, and yellow, which are the stage of the implementation, and regular reviews, and very mortality audits, CHIPS and PIPS, which is a perinatal problem identification program, which compared to other countries, South Africa has been introducing for the last 20 years, and which is much in advance. And I think that this now is covering more and more hospitals as of 2016. And there are district clinical specialist team which look at the quality of care, and re-engineering of the primary health care, I think, is currently in place. And there is an overarching, the National Development Plan, which is also overlapping with the same period of the SDG and global strategy, which is looking into a work for everyone and produces positive health outcome. This is the motto. And look into the demography to increase the longevity of the population in South Africa, and also look into the disease burden of this country, and maternal and child health is given much attention. And also looking into the health system, looking into the universal health coverage, and which is an overlapping with what the global strategy is. So this is some of the thoughts and suggestions that someone coming from outside look into what are the areas that can improve. And there are percentages that you want to reach by 2030, and also have the medium-term strategy framework from 2014 to 19, and you want to reach by this 20 or 30 per 100,000 live birth. I think that not only the percentage are important, but also the numbers are important at the national level, province, and districts. And sometimes that there's a national level, but then if you don't really give each district on what are of course that mortality you don't want to give, you want to reach this level, but this is the limit that you have to reach in order to reach the goal of the country. Also the district health plan, which is, there are district health plans that are prepared by the district every year, but not always prepared based on the need of the district. So it's more important that do the data analysis, do the bottom analysis, what are the areas that need to improve, and then the funding is based on the need. So it's more of a targeted approach, and I think that we are so proud to say that UNICEF is supporting the government in 3-feet approach. How the 3-feet approach, we're going to see what are the bottlenecks, what are the actions, what could be done to improve the coverage, improve the indicators. And I feel that there are also the investment in human resources. When I said that human resources is a big topic, it is in fact talking about the skills, the quality of the staff, the availability of staff in the right person and right place, and also non-negotiable, sometimes non-rotational stuff in like a newborn, neonatal unit. If you have the staff rotating from one unit to another because of the policy, sometimes it will going to lose the skills which already built in some of the places. Yeah. And also, when I also talk about information sharing of quality improvement, is sometimes there's a good initiative happening in provinces, and sometimes that information doesn't really come together. Like for example, Limpopo, Dr. N. Robinson has done the good job in the neonatal care, what are the practices, but not necessarily come into the national level to discuss and to share the experiences, to learn from each other. And of course, the accountability is always the most important part for the managers, to the head of the department, to all the staff to be taken care of. And lastly, but not the least, public health in every country, I think that the evidence shows that if you put the more investment in primary health care, a country can improve the outcome of MNCH. So thank you very much. I would just like to show you the very short video talking about what is the 3 feet approach, and then what has been shown here.
The 3 feet approach in South Africa, strengthening district health systems. Every life counts. The healthcare system was struggling to reach the Millennium Development Goals for maternal, newborn child health, nutrition, HIV/AIDS, and TB. In facilities, we noticed poor planning and problem solving, and lack of motivation. We needed to change. The cost in human lives was too high. A national review recommended 3 areas. 1, know your issues, track your response, be accountable. 2, get the basics right, focus on quality of care. And 3, connect the dots between service points and between facility and community. What will happen, we thought, if we focus on one thing, accountability, and if we start at the 3 feet level, the interface of health facility and community, and go from 3 feet to sub-district, to district, to province, to national? What then? The 3 feet approach outlines 4 key role players: the driver manager, the navigator, information expert, the technical expert, and the community, and a set of tools for understanding issues and tracking actions. The tools cover all levels of healthcare delivery, are color-coded to help understand data in a visual manner, so it's easier to track performance. Red means not reaching targets, yellow says there's improvement, and green indicates success. There are 4 tools at facility level. 1, data dashboard lists indicators and color codes performance. 2, the run chart shows numbers and tracks monthly progress to understand trends. 3, the 3x4 matrix identifies bottlenecks in the environment, quality of care, supply chain, and demand, and helps identify actions. 4, the action dashboard tracks the progress of actions. 3 true stories to illustrate the impact of these tools. At Facility A, community beliefs and lack of knowledge about pregnancy status prevented many women from starting antenatal care early. The 3x4 matrix identified screening every woman of childbearing age for pregnancy as an action. Result, an increase in numbers of early antenatal bookings, from red to yellow to green. Then there was the case of the 20% of clients at Facility B who were not completing their TB treatment. The facility team used the 3x4 matrix and tracked their actions through the Action Dashboard. They identified the missing clients, traced them, and returned them into care. Now, less than 6.8% are lost to follow-up. Green. Facility C's target to distribute 83,000 condoms per month was actually less than 5,000. By using the data dashboard and 3x4 matrix, the facility team understood their targets, saw that there were blockages in the supply of condoms and problems in the link between facility, community, and local industry. Working closely with partners to clear bottlenecks, this facility now distributes more than 80,000 condoms per month. Green. Now, in some cases, bottlenecks can't be resolved at facility level. They must be escalated to higher levels. The sub-district and district levels set up at a monitoring and response unit, MRU, which for now are ensuring key critical actions for averting maternal, newborn, and child deaths. Planning and review meetings also track bottlenecks and the actions taken through the system. They are then allocated budgets in the annual district health plan and monitored at the district health expenditure reviews. The 3 feet approach has led to improved maternal, newborn, child and women's health, HIV/AIDS and TB continuum of care outcomes, as well as empowering people at facility level. Everyone wants to be a winner. Together with our partners, we identify problems, remove bottlenecks, and reach our targets. A ripple effect of green from facility to sub-district to district to province to national, not once, not twice, but every single day. Green all the way.
I don't know how to stop this. Yeah, okay. Thank you very much for attention.